The Thomson Test Chart can be used from any viewing distance and on any size display. However, we normally recommend you use a display screen of a minimum of 24 inch. 27 inches is good, but it can be used on any size monitor as long as you calibrate it properly. In terms of viewing distance, again, the program will work from any viewing distance if you put in the correct viewing distance. But we recommend that if you are using the chart just to measure visual acuity, you try and get a minimum viewing distance of 3 meters, 2 meters as an absolute minimum. If you come any closer than that, it's not really a test of distance visual acuity. If you're using your chart for refraction, we strongly recommend you try and get 4 meters as a minimum viewing distance. Anything greater than 4 meters is good. The reason for that is that if you come closer than 4 meters, there is some evidence that you get a less stable endpoint to refraction, and you have to start making some allowances in terms of accommodation. Of course, if you're in a fairly short room, you can always use a mirror, which effectively doubles the viewing distance. But it is really important, whatever viewing distance you decide to use and whatever size monitor you use, that you actually run through a calibration before you start using it. To do that, you move the mouse cursor to the top of the screen and you select Setup, and then you click on Show Size Calibration Screen here. This will put up a big letter E on the screen, and you need to put a ruler on the screen and physically measure the height of that letter E, and that goes in this box here, so that's in millimeters. You also need to measure the width of that horizontal line at the top, that goes in there, and you need to measure the height of that vertical line, and that goes in there. And your viewing distance goes in here. This is the total viewing distance from the patient's eyes to the test chart. If you're using a mirror, then make sure that you have selected mirror optotypes here, and the viewing distance is measuring from the patient's eyes to the center of the mirror, and then from the center of the mirror back to the test chart. It's the total viewing distance, and that's the primary chart viewing distance. This is the main one to worry about. The program does have the option to enter a second viewing distance. For example, you might want to put in a second viewing distance for patients in wheelchairs. They may need to sit slightly closer to the chart, maybe a meter closer, and you can enter that there. And then there'll be a button on the screen which enables you to swap between those viewing distances at the click of a button instead of having to change the settings. So it's as simple as that. Put in the correct measurements and then click on Save. The chart will then regenerate, and you can be certain that the letter size is exactly correct for that viewing distance and that size screen.